Okay, this is going to be the Respiratory Anatomy and Physiology lab, where I'm going to tell you and demonstrate where things are found on the different models that we have here, and then I'll take some images and upload them as well. So let's talk with the beginners. So we're going to start with the nasal cavity. So here is the nasal cavity. The hole is the external nair. Then you have these three stair steps. They're called concha. You have your inferior, your middle, and superior concha. And in between, the space between each of these is called a meatus. So you have your inferior meatus, your middle meatus, and your superior meatus. Then we're going to go down into the trachea. In the trachea, you have these folds, okay? Those are going to be your vocal and vestibular folds are found right here, okay? There's another head model, which is going to be right here. Same kind of idea. You've got your nares, your external nares, which is the hole. You've got your three concha, A, B, and C, and the meatus is going to be the space between. Okay, so you have tonsils as well that you have to know. There's going to be two tonsils. You've got your palatine tonsil. Palatine means near your palate, which is going to be here. And then you have your pharyngeal tonsils, which are going to be here, right near your pharynx. Okay? Pharyngeal, palatine. Okay? Here is going to be your epiglottis, and again on another model you can see it's represented in blue here. The epiglottis is what tries to direct, if you will, traffic, food going down the esophagus rather than the trachea, which would be air. So it's open for air to go down. If you're swallowing, it'll close and cover this, and it goes down the esophagus. We continue to move into our newest models. Okay, I'm going to turn it on its side. Let's try to get it so you can see. All right, so you should remember what this is. This is going to be your hyoid bone. Here's that epiglottis. It really does look like this spoon-shaped cartilage that you can clearly see here. And it does move. It opens and closes depending on what you're trying to move down. Okay? This right here is called the laryngeal prominence. That would be what you refer to as the Adam's apple right here. This is going to be your thyroid cartilage, this area right here. Here's your thyroid gland itself. Okay, I'm going to just turn it this way so you can get a different view. This first one right here is going to be called your cricoid cartilage. And then lastly, the cartilage here, which you can feel if you grab your throat, that is going to be your tracheal cartilage. Okay, so this whole model represents your larynx. Okay, so let's move into the actual lungs. So let me start better for you to see. Okay, so if we're talking about the lungs, you can see your heart is here, and then you have your right and left lungs. I'm going to just switch it this way. Okay, so if we talk about that, we talk about the fact that there's bifurcation. What I mean is, as the trachea comes down, it splits into either lobe. That's going to be your primary bronchi. It's your first split. So here's your trachea coming down. It splits this way, and it splits this way. Okay, and you can see, only thing I wanted to show you on this, that it bifurcates. That means it goes into the different areas of the lung all the way from primary to secondary bronchi to tertiary bronchi, and then eventually it will hit your alveoli. Okay? Okay, so when we're talking about the lungs themselves, so if we pull them separate, you can tell right and left lung, because remember the heart is going to sit and have plenty of space under that left lung. Remember, switch hands. Okay, this is right. See, I'm going with my right hand. Then this has to be left. There's space for the heart underneath here, so it only has 2 lobes, which you can clearly see divided by this fissure. So this has to be a left lung. If we're talking about a right lung, you can see that there is 3 lobes and there are 2 fissures. There is more lobes because the heart is not sitting underneath this one. And you can see there's plenty of space here for the heart to sit. I'm going to move to that big model that I affectionately call George. Okay, on the George model, here is that split that I was talking about. Coming down the trachea, there's that first split. That is your primary bronchi. And if you look, which is really cool, here's your primary bronchi. So here's your first one. Any path or tube, if you will, that comes off of the primary is considered secondary. So this right here, you see how it's detouring off? This is going to be secondary. Primary, secondary. Do you notice this little one here and this one here? Okay, this is coming off of secondary, so it's tertiary. Again, here's where it splits. Primary, secondary, tertiary. This right here is the diaphragm, which you're going to learn is very important in aiding for breathing. Okay, and then you have protection of the lungs, which I know you're going to talk about in lecture as well. You have parietal and viscera pleura. Okay, here it's represented here.